ਇਸ ਸੈਗਮੈਂਟ ਦੇ ਵਿੱਚ ਅਸੀਂ ਗੱਲਬਾਤ ਕਰਨ ਜਾ ਰਹੇ ਹਾਂ ਅਲਬਰਟਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਟਾਇਲਰ ਸ਼ੈਂਡਰੋ ਦੇ ਨਾਲ ਜੋ ਮੇਰੇ ਨਾਲ ਲਾਈਨ ਤੇ ਨੇ। ਗੁੱਡ ਇਵਨਿੰਗ ਮਿਸਟਰ ਐਂਡ ਵੈਲਕਮ ਇਨ ਦਾ ਫੋਕਸ ਪੰਜਾਬੀ ਪ੍ਰੋਗਰਾਮ।
Good evening. Thanks for having me back.
ਹਾਊ ਇਜ਼ ਯਰ ਡੇ ਟੂਡੇ?
It was a great day. Great day. Yeah. You had a good day?
Yeah. So my first question is that the Alberta government has expanded COVID-19 testing to pharmacies. Can you give an update for that?
I can. So we started with a pilot project as we had announced some weeks ago. The pilot project was successful. We started with 30 pharmacies so that we could learn about, first of all, how to the logistics of it all to get the kits to the pharmacies and then to Prov Lab for the kits then to be tested. How many each pharmacy would need and how regularly they need them. So now that's been successful. We're slowly expanding it. I think we have over 120 pharmacies right now who are now on board, and we'll continue to grow that out to pharmacies throughout the province.
Alberta Medical Association has released a survey that 42% of the physicians are willing to leave the province, not because of the money, but because of the government has lost their trust. What do you want to say about this?
Well, look, that's fine. The AMA is entitled to have a survey if they like. But look, we had an election last year, and our government received a mandate from over 1 million Albertans who voted for this government and voted on a platform to bring our wait times for our surgeries and other types of wait times down, as well as to continue to make the system more efficient. That's exactly what we're going to continue to doing, regardless of whatever surveys the AMA decides to do.
Mhm. Are there any new updates in the negotiation with the AMA?
Well, I'm happy to meet with the AMA anytime they like. I think we will be meeting with them again this week. We announced on February 20th a new framework for how physicians are funded. We're very happy to have been able to announce that and to confirm that physicians are the most generously paid here in Alberta, and we'll continue to make sure that our physicians are generously compensated. If the AMA ever wants to meet with us and discuss any topic, especially the topics that are related to how they're compensated, we're happy to meet with them, and we will continue to do so.
Over 90% of the cataract surgeries in the Calgary are done privately, and in Edmonton it is around 35%. But the waiting in Calgary is still higher. What do you want to say about this and why it is so?
Well, look, we campaign on a commitment to get all of our wait times down for all of our surgeries, and unfortunately, COVID has made it a little bit more difficult. Our surgical wait times. I think the amount of people who are on a waiting list right now has grown to about 74,000 people, but we're at maybe about 75% of our pre-COVID surgical capacity. By September, at least by the end of the year, we're going to be at 100%. And soon after that, at least by July of next year, we're going to be at 150% of our pre-COVID capacity so that we can make sure that all of our surgical wait times throughout the province for every patient is going to be what's clinically recommended. So for 78% of all surgeries, that will mean that those surgeries are done within 4 months. But no other jurisdiction is able to do that, to meet those clinically recommended wait times. But that's exactly what we're going to be doing to be able to meet the needs of Albertans throughout the province.
The government is investing public money to build private facilities when more than 700 nurses in public health even lose their jobs. What do you want to say about this?
Well, no. We're investing $100 million in our public facilities to expand the operating rooms in our public facilities, the facilities that AHS owns. $100 million to be able to invest and to expand those operating rooms throughout AHS's facilities to make sure that those operating rooms can meet the demands of a system, because we are, as I said, going to be having many more surgeries to be able to bring our wait times down in Alberta. So it's $100 million invested in AHS, our publicly owned facilities.
Can you talk about the EMS consolidation? Why is this needed?
Sure. No, very happy to talk about that. So right now, and maybe actually going back to give a little bit of context, our ambulances, our paramedics throughout the province used to be municipal employees, the same way that our firefighters are hired and employed by the municipalities. That changed some time ago, and our paramedics then became employees of the health regions. Now we only have one health region, it's AHS, so our paramedics are employees of that. And at that time, there was talk about consolidating dispatch as well, so there'd be AHS employees who dispatch them. 4 municipalities have not been consolidated. That's Lethbridge, Calgary, Red Deer, and Fort McMurray, the regional municipality of Wood Buffalo. And so for the last 10 years, there have been a number of reports that have recommended that those 4 municipalities also be consolidated, just like the rest of the province. And look, our focus is as a government, and we support AHS doing this, is a focus on making sure that what the decisions we make are going to ensure that our paramedics who need to arrive on the scene are getting there as quickly as they can, that Albertans can rely on our paramedics, and that people can get to the care that they need throughout the province. So that's exactly what's going to be happening, and the reasons why we're supporting AHS in this decision.
The legislation session ran long this year. Can you discuss the important health legislation that was passed?
Sure. Well, there are 2 bills that were related to responding to the pandemic, Bill 10 and Bill 24, to allow us to be able to reply and to respond to the pandemic and make sure that we had the resources that we needed to take care of Albertans throughout the pandemic. There's also Bill 30, which focused on trying to make some changes to make our health system here in Alberta more patient-focused. So some changes to the legislation that deals with our surgical facilities. So again, we can meet the wait times that we're targeting to be able to bring our wait times down here in Alberta, as well as other ways in which physicians can choose to be paid, all with a focus on making our system here in Alberta patient-focused.
Anything you want to say in the end to our listeners, Minister?
Well, just thank you again for having me again on your show. It's wonderful to speak to you again. Hope everyone is taking care throughout this pandemic. And thank you very much again for letting me be able to speak to you and to your listeners and your viewers.
So thank you very much in the end for joining my show. Thank you.
Thank you. Good night.
ਸੋ ਇਹ ਸਨ ਅਲਬਰਟਾ ਦੇ ਸਿਹਤ ਮੰਤਰੀ ਟਾਇਲਰ ਸ਼ੈਂਡਰੋ, ਜੋ ਸਾਡੇ ਨਾਲ ਵਿਸ਼ੇਸ਼ ਤੌਰ ਤੇ ਗੱਲਬਾਤ ਕਰ ਰਹੇ ਸਨ। ਕਮਰਸ਼ੀਅਲ ਬ੍ਰੇਕ, ਉਸ ਤੋਂ ਬਾਅਦ ਅਗਲੀ ਵਿਚਾਰ ਚਰਚਾ ਲਈ ਮੁੜ ਵਾਪਸ ਆਉਂਦੇ ਹਾਂ।